Hello, hope I am audible. Today our discussion will be on separation of teeth. Myself, Dr. KRIPA, Senior Lecturer, Department of Conservative Dentistry and Endodontics, Royal Dental College, Chalishiri. So what is tooth movement? It is the act of either separating the involved teeth from each other, bringing them close to each other, or changing their spatial position in one or more dimensions. So what is the need for tooth separation? It is either for a caries diagnosis or a proximal cavity preparation to place a matrix, polishing or finishing the proximal restoration, repositioning the drifted teeth, and also to remove foreign objects. So what are the methods of tooth separation? You have rapid or immediate tooth movement, slow or delayed one. Rapid or immediate tooth movement is achieved through the mechanical type of separation, which creates either proximal separation at the point of separator being introduced and improved closeness opposite to the point of separators getting introduced. So rapid separation is usually a preparatory phase to slow tooth movement. Also, to maintain the space which is gained through slow tooth movement. What we have to keep in mind is that when you create a tooth separation, it should not exceed the thickness of the involved PDL space, that is 0.2 to 0.5 mm. If it is encroached, it will adversely affect the tooth stability. Now, rapid or immediate tooth movement is achieved by two methods. One is wedge method, the other is traction method. Wedge method is achieved either through placing certain mechanical devices as wedges, or there is a separator which is iliac separator. The placement of a pointed pet-shaped device which is placed more, which moves the tooth more facially or lingually as the separation increases. Then there is iliac separator, which is a short duration separation which does not necessitate a stabilization. This is basically used in examining proximal surfaces or also in finishing or polishing the restored contact. So as the diagram you can see, it is a mechanical device. You can see there is a single jaw with the pointed probes on both sides and a knob for adjustment. These are called as jaws, and the knob is adjusted. As the jaws comes closer, separation will achieve. So it's a single bow with two jaws and an adjustable knob. Position the jaw interdental gingival to contact area. And when you turn the knob clockwise, the jaws moves towards each other, wedging the teeth apart. Then you have wedges, which is usually placed in the lingual embrasure because this embrasure is quite large. But if there is an interference for the patient, it can be placed on the buccal side too. Length of wedge is ½ inch or 1.3 centimeter, so that they do not irritate the tongue or cheek. Now, what are the functions of wedges? It will provide achromatic retraction of dam and gingiva from the tooth margin to control bleeding and moisture, correct the contour for cervical portion of restoration, prevent gingival overhangs, to accommodate the matrix band, stabilize the band and retainer until restoration is completed. Wedges are classified on the basis of method of fabrication as custom-made wedges and prefabricated wedges. On the basis of material used for fabrication, it is wooden wedge, plastic or synthetic resin wedge. Custom made wedge. So actually these are either wood or plastic wedge will be trimmed to match according to the embrasure space, which is done with gold knife, scalpel or diamond stone. So, then we have prefabricated wedges which are available in different sizes. This is not custom made. These are prefabricated. We use according to the embrasure. Then we have wooden wedge, which is either from pine tree, soft and resilient. If it is from the oak tree, it will be quite hard. Now, what is the advantage of a wooden wedge? It will be easy to trim and shape such wedges. And wooden wedge will also absorb water. So that is well, and this will have an advantage of providing an improved retention. The triangular shape wedges are commonly used ones because embrasure spaces are also triangular. So it is a triangular wedge which will have a proper adaptation to the space. So especially if the margins are deep seated, it is a must to use a triangular wedge. So triangular wedges in cross section, the base of the triangle will contact the interdental papilla. Two sides will coincide with the corresponding embrasure, and the apex of the triangle will point towards the gingival start of contact area. And when you use triangular wedges of wood or synthetic resin, you can use. Medicated ones are also available. So you can see that wedges are tapering triangular piece of wood or plastic 1/2 inch in length. So you can also call the triangular wedges as anatomic wedges. They are recommended for preparation with deep marginal seat. The marginal wedge, the triangular wedge is indicated with your topple where when the gingival margin is deep cervically, base of the triangular wedge will more readily engage the tooth margin without any soft tissue displacement. And this better adapts because its greatest cross section is at the base. So here picture clearly shows that embrasure space is also triangle. So if you place a triangular wedge, the base coincides with your interdental papilla, apex points towards the start of the restoration, and the sides will coincide with the embrasure. Round wedges can also be used when it is not so deep seated. Plastic wedges are either transparent or metal. This is the round shaped wedge which has its correct placement. These are synthetic resin or plastic wedges available in various colors and sizes. So here you can see the wave shape of the wedge also. These wedges are easier for placement through the embrasure as they'll enter fast and patient will have least discomfort. Then is the very important light transmitting wedge, which is transparent with a light reflecting core within. For class 2 composites, to transmit 90 to 95% of curing light, draws the curing light towards the gingival margin, directing the polymerization to engage towards the margin. This will also provide a better margin adaptation of the restoration cervically. So you can see the light conducting plastic within and the soft moldable base for adaptation to the tooth and inner white core for light reflection. So this is how wedge is placed from the lingual embrasure. So you can see the where they are shaping the wedge with the various instruments according to the embrasure size. If the proper size cannot be found, you can modify so that they will fit to the interproximal area properly. Now, how are they inserted? Break off the end of toothpick, grasp the broken end of wedge with the number 110 plier, place it from the lingual aspect because this embrasure is the widest and therefore is often in greater need of adaptation of band by the wedge. Now wedge should be positioned as near to gingival cavo surface margin as possible without being occlusive. If necessary, you can lubricate your wedge for an ease of placement to reduce friction. Wedge not only stabilizes the matrix, but more importantly, it is placed below the gingival cavo surface margin to prevent amalgam from flowing beyond the cavo surface margin in that area. This area is the most inaccessible area for carving. Therefore, it is critical to place a wedge that will prevent excess amalgam flowing to the gingiva and thus avoiding overhang. So the three diagram, the first is the correct placement, gingival to contact area, whereas the other two are incorrect. If the wedge is placed very occlusively, as in the second diagram, the band will be pressed into the preparation, creating a concavity in the proximal surface of restoration. In the third picture, you can see the wedge is gone too apical to the gingival margin. And also the band adaptation will be compromised. This will create more of gingival excess caused by band moving slightly while condensation of the amalgam, creating overhang which can result in irritation of gingiva, plaque accumulation, and evident bone loss. So this is about the single wedging techniques. Now you have certain specialized wedging techniques for certain special situations. One is the piggyback wedging. If the wedge is significantly apical of the gingival margin, a second wedge may be placed on top of the first, adjusting the matrix against the margin. That means if there is a gingival recession. This type of wedging is useful for patients where interproximal tissue level has receded. To check the tightness, gingival wedge should be tight enough to avoid overhangs in at least the middle third of gingival margin. Next is double wedging, permitted securing the band when proximal box is very wide facial. Double wedging refers to using two wedges, one from the lingual embrasure, the other from the facial embrasure. The two of them ensures that the gingival corner of the wide proximal box can be properly condensed to avoid overhangs. However, double wedging should be used only if the middle two-thirds of proximal margin can be adequately wedged. Because of the facial and lingual corner are accessible to carving, proper wedging is important to prevent any excess of amalgam in the middle two-thirds of proximal box. Wedge wedging. Occasionally, concavity may be present on the proximal aspect in the gingival margin, especially on surface with a fluted roof, like the mesial aspect of maxillary plus premolar. In such case, you use a specialized technique. Gingival margin located here will be concave. To wedge a matrix band tightly against such a margin, A second pointed wedge can be inserted between the first wedge and the band. This is called as wedge wedging. Wedging action between the teeth should provide enough separation to compensate for the thickness of matrix band. This will ensure a positive contact relationship after the matrix is removed. So before going to the summary, I would like to add a note on pre-wedging. There is an important concept called pre-wedging. That means we place a wedge prior to start of preparation. This is very important because when we try to wedge at the point of restoration, actually the separation that we get is not so adequate. That's what studies say. So we need to practice something called pre-wedging. Then by the time we start to restore, or by the time you start to adapt your matrix, you will get enough separation so that once the wedge is removed, the tooth will gain its physiological position, contact will be perfect. Otherwise, at times, sometimes even after a proper wedging, which you have done along with your matricing, still some cases the contact becomes improper. The reason behind this is what I have just now explained. That shows the importance of pre-wedging. So that's what I wanted to add on here. Now, in the subsequent slides, students will get an opportunity to revise what we have gone through just now. So here you can see that this is a molar tooth. You can see this is a specialized wedging technique. The two wedges are there. One is placed above the other. So students, can you guess what type of wedging technique is this? Yes, this is a piggyback wedging. In cases where there is gingival recession. Now coming to the next diagram. See the clinical photograph. You can see one wedge is placed from the buccal and the other from the lingual. So what type of wedging is that? It is double wedging. In cases where the proximal box is wide, facial-lingually. The one which you see above is also a specialized technique, which is that is wedge wedging. That is for a maxillary first premolar, where a second wedge is placed between the first wedge and the matrix band. Hope it is clear. Now, once you have done with the placement, you have to check for the tightness. Now, how do you do that? This is the usually asked chair side question to the preclinical students and also to the part 2 students. Test for tightness of wedge by pressing the tip of an explorer firmly at several points along the middle two-third of gingival margin against the matrix band to verify that it does not move from the gingival margin. As an additional test, you can attempt to remove the wedge with a moderate pressure too. See to it that it does not dislodge. So with an explorer tip, you can ensure the proper adaptation of band to the gingival margin. Press and drag the tip of explorer along the gingival margin in both directions to ensure the removal of any friable enamel, which can break down and create problems in the later half of restoration. Then you have the traction method achieved with a mechanical device which will engage the proximal aspect of teeth separated by means of folding arms. Here comes the non-interfering true separator and a Ferrier double bow separator. Separation achieved is stabilized throughout the operation here, not like your iliac separator where there is no stabilization mode. An advantage is that the separation will be shared by the contacting teeth. It is not done at the expense of a single tooth. So you have two bows here. Each has its own jaw, two jaws. Jaws of each bow will engage embrasure of your contacting teeth, gingival to the contact area. French turns the threaded bars to create separation, and this is mainly used in direct filling gold. So here you can see the photograph of the rear double bow. It has two bows with their own jaws and the Frenches. So with that, our rapid tooth movement session is over. So once more as a summary, I will suggest you just revise the function of tooth separation, the different nodes of creating separation. We were discussing about rapid tooth movement. In that you had two methods, wedge method and traction method. In wedge method, you can either use mechanical device as wedges or an iliac separator. The problem there was there is lack of stabilization. Once it is removed, they'll come back. That's what is meaning. And how you had placed the wedges, how you check for its tightness, how well it adapts to your tooth, what are the different types, which form is better. You have seen the anatomic or triangular wedges are the most advantageous because it coincides with the shape of the embrasure. And what all are the different other mode types of wedges and the various techniques, the simple technique and the specialized technique. And very importantly, the length of the wedge and where you place, the reasons behind it, the advantages of wooden wedge, how you check the tightness. All these are the usually asked viva questions for your exams. Now you move on to the slow or delayed tooth movement. This is indicated when the teeth have drifted or tilted considerably. Rapid movement of teeth to the proper position, if you feel will endanger the PDL fibers, you can go for a slow movement. This will take place over a period of weeks for a proper repositioning in a physiological manner. So what are the different methods? You can use a rubber dam sheet, separate ligation wires, oversized temporary crowns, and orthodontic appliances. Separating wires, thin pieces of wire introduce gingival to contact, wrapped around the contact area. Two ends will be twisted together to create a separation, not to exceed our physiologic limit of PDL space width, which we have already discussed, 0.2 to 0.5 mm. And the twisted ends are then bent into the buccal or lingual embrasure to prevent impingement upon the soft tissue or interference with the food flow. The wires are then tightened periodically until you get adequate separation. This is very effective method of slow tooth movement, although maximum amount of separation will be according to the thickness of wire that you use. So based on what amount of separation you require, you should decide the thickness of wire to be used. Rubber dam sheet, you can use heavy or extra heavy dam. Separation occurs according to the thickness of the rubber dam sheet that you use. Rubber dam, maybe you are not so familiar. Rubber dams are actually means of isolating the operating field. That is a sophisticated technique than what we routinely use, our cotton things like that. Rubber dams are used for isolation, and the sheet will have actually it's a kit. It includes your rubber dam sheet, pliers, clamps or retainers to hold the rubber dam to the mouth. So today itself go through what is rubber dam. Okay, and the sheets are available in various sizes. So what you need for separation is your heavier, extra heavy dam sheet, because they will be a bit thick. So when you introduce it between the teeth, that itself will create some amount of separation. Then oversized temporary crowns made of resin, which are oversized mesiodistally in increased width to achieve a slow separation. And we'll go on adding resin to the contact area so that the separation will also increase, which does not exceed the physiologic limit of 0.2 to 0.5 mm in a visit. So in this context, I would like to suggest a thing. That means, actually, apart from these, there are other also many other means for slow separation. One such thing is putting certain not brackets. Actually, they are certain separators. They are available as separators, which orthodontic people use to create some separation. They are provided with something called as separators. They are plastic ones which are inserted with the help of various instruments into the contact to create some amount of movement. So such things are also available in market. So in this context, I just wanted to add that too. Then we have orthodontic appliances. For tooth movement of any magnitude, fixed orthodontic appliances will be effective, predictable method. Comparable end results can also be achieved with your removable orthodontic appliance. But what the problem with the removable appliances, it will take a bit long time. So that's about separation. And after repositioning of tooth with a delayed tooth movement, it is necessary to use one or more immediate tooth movement techniques just before or during the restoration fabrication to create a space and to compensate for the thickness of band material. So we cannot go for a restorative aspect with a slow separation. For that, we require something like a rapid tooth movement itself. That too, as I have described, pre-wedging do play a very important role as far as restoration is concerned. Actually, we need to place a wedge prior to preparation so that separation is created prior, so that there is an ease of preparation. You can see the proximal aspect well. You can place the matrix band also in a very nice way. And most advantage part is that after removal, you can see once it gains its physiological state, there will be a proper contact and contour. Otherwise, what will happen is there are chances of aberrant contact, open contact, or things like that can happen. So that's it. So as to conclude, I would say tooth separation is a very important topic in that the wedging, the techniques of wedge, and the various methods of various types of wedges. All this are important and that you should keep in mind. Thank you. Have a nice day.